For the first time ever, recorded a double-digit COVID-19 deaths in a single day. The Ministry of Health says 12 people died over the last 24 hours, bringing the death toll arising from the COVID-19 to 197. This as 189 more cases of COVID-19 were reported in one day. And as Mark Namaswa now reports, the government was also hard-pressed to explain whether COVID-19 testing was free in its facilities.
It was a sad day in Ndalu area, Bungoma County, as Dr. Doreen Lugaliki, the first medical doctor to die of COVID-19, was buried today. Dr. Lugaliki succumbed to COVID-19 2 days ago after contracting it while treating patients in Nairobi. Family and friends hailed her as a dedicated medic and family member. And as the village rested one of her most promising members, in Nairobi, the country was receiving news of its largest ever COVID-19 casualty list in a single day.
At 12 patients have died as a result of COVID-19. All the 12 are here in Nairobi. 3 of the cases actually died at home.
This number comes barely a week after government decided to lift cessation of movement measures across Kenya. These rising numbers are not encouraging.
We still managed to test some 1,205 samples, out of which 189 people have tested positive. Thus, we have now 10,294 people who have now tested positive in the country.
But even as the government grapples with these numbers, it is facing yet another problem. Testing for COVID-19 is becoming another headache for the government. Some government facilities, such as Magathi Hospital, are no longer testing walk-in clients, but instead, people are referred to Kenyatta National Hospital, where they are expected to pay 5,000 shillings.
Mass testing identified as targeted mass testing, we do not charge anything. However, as Daktari is correctly saying, we are not doing testing for everybody.
KNH decided that answering a question on mass testing was easier than answering one on walk-in clients.
About the charges, when you are picked from the county, we are still charging 1,000. But we had put a program for hoteliers. That's what we were charging, the charges we said.
So we don't want individuals jumping from homes to every other hospital. We are spreading the infection even further. And even those who are following those 7, you are establishing yourselves as contacts already.
Kenya also recorded 65 recoveries, bringing the total number to 2,946 so far. Did Kenya make the right decision in easing COVID-19 restrictions or not? This is the question lingering on many people's minds. Mark Namaswa, KTN News.